assistance from the new law. We are excited to make this bigger than last year. Alongside all of you, we're also working hard this open enrollment period to target outreach to our hardest to reach communities. The work all of you do to meet people and families where they are in their places of worship will help us reach underserved and underinsured communities so that they can get enrolled and get access to health care. Speaking of families, I'm excited to mention that we're fixing that family glitch. And for the first time, families with offers of employer health coverage may have new opportunities for savings on healthcare.gov, even if they weren't eligible last year. And finally, I want our listeners tonight to know that CMS is committed to advancing health equity. And my office specifically is tasked within CMS to help ensure health equity is a part of everything that we do. So we're thinking about how this affects people of racial and ethnic communities, people with disabilities, people in rural areas, the LGBTQ plus population, those with limited English proficiency, and others affected by poverty and inequity. And each of these groups may have a hurdle or a barrier. And many of you tonight have probably seen this firsthand through family or friends. And it could be finding providers in your area or hard to afford prescriptions, disparities in health outcomes like diabetes and other conditions that are seen across the board in different communities. So we need our listeners tonight to think about themselves as well as who in their family or community might need a little extra help to be encouraged to shop for plans, or maybe you could help them connect with someone that's able to provide that help. So I'm grateful to have a chance to talk with you about the importance of shopping for plans, applying for financial assistance, or learning about other new savings like on insulin. We're committed to helping everyone achieve their best health possible, but we at CMS and healthcare.gov can't do it alone. So please encourage people to visit healthcare.gov to see if there is a plan that better meets their family's needs at a lower cost. And for people who already have coverage, we're also encouraging them to visit and review their plan options as we do every year. And with that, I will turn it back over to Dr. Miner and to Stephanie to start the question and answer period. And thank you all so much for the opportunity to join you for this important call tonight.
All right. Thank you, Dr. McKeever. And thank you so much for the comments. And certainly we appreciate all the efforts of the Biden-Harris administration. Well, I'm going to turn it over to my counterpart, Lottie, who will introduce Stephanie and field some questions. It's in your hands, Lottie.
Thank you, Dr. Miner, and thank you, Dr. McKeever. Thank you both very much. That was great information. Thank you for reminding us that today is the first day of open enrollment for this year, 2022-23, for the Affordable Care Act. And of course, we also know Medicare open enrollment began on October the 15th. All right, thank you both. So now, Dr. Miner and Dr. McKeever. So now we are fortunate to have Stephanie Costello with us. Stephanie is the director of the Partner Relations Group of the Office of Communications at the Centers for Medicare and Medicaid Services. She oversees stakeholder engagement for CMS, focusing on beneficiary and consumer outreach and education to national organizations. Prior to CMS, Stephanie worked at the Administration for Children and Families. Stephanie has a master's degree in public policy from the Thomas Jefferson Program in public policy at the College of William and Mary. Welcome, Stephanie. So glad to have you here this evening. We've heard about the new benefits. Dr. McKeever shared with us about those new benefits, Medicare beneficiaries who take insulin can now take advantage of. Are you able to share a little bit more about that with us?
Great, yes. So under the Inflation Reduction Act, new insulin benefits for people with Medicare will begin in 2023. These new benefits will not change where beneficiaries get their insulin or how insulin is prescribed. But starting in 2023, people with Medicare won't pay more than $35 for a month's supply of each covered insulin. Deductibles also won't apply to covered insulin. This means that even if someone hasn't met their deductible for the year, they still won't pay more than $35 for a month's supply of each covered insulin. More specifically, beginning in January 1st, 2023, people enrolled in Medicare prescription drug plans will not pay more than the $35 for a month's supply of each insulin that they take and is covered by their Medicare prescription drug plan and dispensed at a pharmacy or through a mail order pharmacy. This includes insulin that is delivered through pens, vials, or pre-filled syringes, as well as insulin derived through newer disposable insulin pumps, also known as patch pumps. And deductibles will not apply to covered insulins. If you take insulin, there is a new out-of-pocket cap on a month's supply for each insulin product that's covered. So if you would like some more information about this and to see what is covered and if your insulin's covered and what is covered with your plan, we encourage you when you're shopping for your Medicare during this Medicare open enrollment to call the Medicare call center at 1-800-Medicare, and they can talk you through everything and answer any questions. We encourage you to do this. We encourage your members of your churches to call the 1-800-Medicare, get the best answers, straight from our wonderful call center.
Excellent. Thank you. So where can we go to get more information about open enrollment? Great.
So specifically for Medicare open enrollment, you can go to medicare.gov. Over the past several years, we've been introducing a number of enhancements to medicare.gov, which helps optimize our customer experience and create a more welcoming and user-friendly experience. Improvements include a redesigned medicare.gov homepage, the addition of pricing details to the Medigap policy comparison, streamlined landing and summary on the Medicare Plan Finder, and a redesigned Talk to Someone section to find additional help and contacts. All of these enhancements improve the overall experience, making it easier to navigate and access information to compare and select health and drug coverage and find providers. So you can go to medicare.gov to find out more about on our website, or you can call our call center again at 1-800-Medicare. And as a reminder, open enrollment for Medicare started on October 15th and runs through December 7th, 2022.
Oh, wow. Thank you. So we know that where to go for Medicare information. So let's move over to talk a little bit about the health insurance marketplace. So Stephanie, what are the important dates? I know Dr. McKeever has told us, but remind us again. We know that November 1st, today is the first day of open enrollment. Yes. Tell us a little bit more about those dates, important dates in regards to enrolling for 2023 healthcare coverage on healthcare.gov.
Great. So there's a couple important dates to keep in mind. So today started open enrollment, November 1st, and this marketplace open enrollment runs through January 15th, 2023. But a couple dates to keep in mind. If you want coverage to start on January 1st, 2023, you will need to make a plan selection by December 15th, 2022. So you need to select a plan sometime between November 1st and December 15th of this year so that your plan will start on January 1st. If you select a plan between December 16th and January 15th, then your plan won't start until February 1st. So if you want coverage for all of 2023, you will need to enroll in a plan by December 15th to make sure you have coverage starting on January 1st. And you can do this by going to healthcare.gov, submitting an application. There, you can call our call center, and you can also find local help, which we'll talk a little bit about later.
Wonderful, thank you. So, and all of that, of course, is contingent upon them paying, if they have a premium, paying that premium as well
Correct.
prior to that date. Wonderful. What's new with healthcare.gov? We know about the American Rescue Plan, and that's new across the board for everybody. But is there anything specifically new about healthcare.gov?
Yes. So, due to this new law, the Inflation Reduction Act, more people will continue to qualify for financial assistance at healthcare.gov. People will be able to find more affordable health insurance plans this year that can help cover things like doctor's visits, preventative services, prescription drugs, and more. Also new this year, if you need assistance signing up, we have expanded our local help options within communities, and we encourage you to visit healthcare.gov and select the Find Local Help option to learn more.
Oh, wonderful. So Find Local Help will tell us where there are assisters or navigators near us.
Correct.
Wonderful, wonderful. We both, well, all three of us, Dr. McIver, you and myself have all mentioned the American Rescue Plan. So can you talk a little bit about how the financial assistance has been expanded for consumers who go on healthcare.gov?
Yeah. So last year we had the American Rescue Plan, which expanded financial assistance. And when the Inflation Reduction Act passed this year, it lowered premiums to the same levels that the American Rescue Plan did the year before. So the short answer is yes, financial help is available, and it's been expanded with the new law that passed, which was the Inflation Reduction Act in August. So it continues providing the same financial assistance to more consumers and at greater levels. People can take advantage of increased financial help on quality health plans when they enroll in coverage through healthcare.gov. They will be able to see savings reflected in their premiums when they shop for coverage at healthcare.gov. And the Inflation Reduction Act has lowered premiums for most people who currently have a marketplace plan and expanded access to financial help for more consumers. So what this expanded financial help means is that 4 out of 5 consumers can find plans for $10 a month or less. I'll say that again because this is really important and it resonates very well with people, right? 4 out of 5 consumers can find plans for $10 or less a month after this newly expanded financial assistance. These are the same high quality plans we've always had. They have, all the same things. And this year they can be found, again, 4 out of 5 people can find them for $10 or less a month. Some people might find that they also qualify for coverage in their state's Medicaid or Children's Health Insurance Program. And they can find this out if they go to healthcare.gov too. And so most Medicaid beneficiaries pay little to no premiums.
Wow. So that's super. So it sounds like for application, for the actual application, as well as whatever financial assistance there is, it's all at www.healthcare.gov. Is that correct?
Correct.
Wonderful. Thank you. Thank you. So if someone received coverage through health last year, why should they check back again this year, or should they check back? And if so, why?
Yeah, that's a great question. So this is good for both I will say not the Medicare and for Marketplace. Every year, it's really important to know that health plan options can change. They can change in cost. They can change in coverage. They can change in who's participating as a provider in that plan. So it's really important to go into healthcare.gov or Medicare.gov and check with your plan to make sure that it is the best plan for you. In healthcare.gov, you can go in and compare your plan you had last year to any new plans that might be available in your market. You might find that the same plan works for you, but you might find something better that meets your needs. Could be better cost, could be better coverage, or it could be a provider in your area that you're looking for your plan to cover. So we encourage you to go to healthcare.gov and check out your plan from your previous year and compare it to additional plans.
Okay, sounds good. So what resources are available for congregations to educate our members? What can we do to assist?
Great. So we've been talking a lot tonight about healthcare.gov, and that's our consumer facing resource. We have another resource called marketplace.cms.gov. And marketplace.cms.gov is where we have our resources for our assisters and for our partners like you, people who want to go out and spread the word about the health insurance marketplace. On this webpage, we have a tools and toolkits. And in that webpage includes materials and resources for partners like yourselves to help promote open enrollment. We have materials such as brochures, fact sheets, conference cards, and postcards available in multiple languages. Some topics include value of health insurance, key dates for the marketplace, excuse me, questions to ask yourself when choosing a plan, and more. These digital copies are available on marketplace.cms.gov, but you're also able to order them for free. We can order up to 50 copies of each of these, and they can be delivered right to your congregation, and you can have them in the back so people can pick them up and take them home with them. So you can order them from free. The link to that warehouse ordering site's on there. And then you're also welcome to print the digital copies yourself. Also on this website, we have some special pieces of resources for theme weeks. During open enrollment, we celebrate different audiences, 1 or 2 per theme week. And it runs from now through the rest of open enrollment. So this week is is open enrollment begins and our Latino Week of Action. Next week we have our Black American Week of Action and Disability Week of Action. And then I know y'all will be interested. Our Faith Week of Action is going to be the week of January 1st. And so that's the week we want all the congregations and all of our faith partners from across the country to really promote health insurance and make sure people are getting enrolled. So again, our Faith Week of Action is the first week in January. Each theme week, we have toolkits specifically for those theme weeks, and they include 5 things consumers need to know and special social media graphics and messaging, as well as talking points. So you can find all of this and other great information. I'll put it in the chat so y'all can get the link, but marketplace.cms.gov.
Wonderful. Marketplace.cms.gov. And then we talked about healthcare.gov. And the Medicare website again
is medicare.gov.
Medicare.gov.
We like to keep it simple.
We keep it simple. And the finding help in our communities, I believe it's Find Local Help.
Find Local Help, correct. From
the healthcare.gov website.
Yes, you can get there directly from healthcare.gov.
Wonderful. Thank you. This has been great information. This is helpful. I see that our viewers are typing questions in the chat, and that is exactly what we want you to do. And we will try to cover as many of those questions as we can as we move along in this webinar. So thank you, everyone who's watching, for putting those great questions in there. Stephanie, is there anything else that you would like to share with us this evening?
No, I think that's it. We just encourage you to help spread the word. We thank you for all the work y'all done so far. We look forward to working with you this open enrollment to get the word out and help us get as many people get covered as possible. That's our goal. And today's a great day to have this webinar on the first day of open enrollment. So thank you all in advance for spreading the word to your congregations.
Wonderful. It's our pleasure, and we'll keep doing it. Thank you. Thank you, Stephanie Costello, and thank you, Dr. LaShawn McKeever. We appreciate you both. I've got to take a moment to talk again about our sponsors this evening, the All of Us Research Program. We have to remind you again, please, ma'am, please, sir, join All of Us. The website is www.joinallofus.org/NBCUSA. Go ahead and do it this evening. It doesn't take that long. Do the enrollment while it is fresh in your mind. The landing page for the National Baptist is the one that you should look for. If you do not see a picture of myself and Dr. Minor, the one that you see on your screen, you're probably not at the right landing page. We want the folks at All of Us and the folks at NIH to know that the National Baptist Convention USA Incorporated is mobilized. That's why we say Go to that site, www.joinallofus.org/NBCUSA. B, 1 in a million for families who have lost a loved one to breast cancer or to diabetes or to pancreatic cancer. The list goes on and on and on. Let's talk a little bit about this month's health observances. There are several for the month of November. This month, we will see quite a bit of blue and purple as we observe Diabetes Awareness Month, Pancreatic Cancer Awareness Month, National Alzheimer's Disease Awareness Month, and National Caregiver Month. And finally, the Great American Smokeout is this month as well on the 17th. So for more information about any of those observances, you may direct your email to us at info@hopenbc.com. info@hopenbc.com, and we will give you links to resources that your church can use to educate your congregation about these observances. First of all, let's talk a little bit specifically about American Diabetes Month. November, as we before mentioned, is American Diabetes Month. It's our chance to show the world that life with diabetes is real, what it's really like, and provide ways that people can manage it. Every year, our community comes together to ring the alarm on the diabetes epidemic. For the millions of us who are at risk for it, it's time to get educated, find resources, and make sure all those around us are aware of their risk as well. And for the millions of those who are living with diabetes, it's a chance to tell your story and awaken the world. Until we find a cure, we will find each other and lift each other up. Now, let's talk about our monthly Let's Move National Baptist update. And this is what I enjoy so much. So you know what that means. We're going to hear from our NBCUSA movement guru, Sister Nettie Johnson, and she is there with that wonderful smile. I needed to see the smile tonight, Sister Nettie. She's going to share with us updates about the Let's Move National Baptist, and she's going to conduct, I wish I had a drum. She's going to conduct our October drawing. Sister Nettie, ma'am, it is in your hands.
Thank you so much, Sister Minor. And as always, it's a pleasure to come in and share a little bit about movement in the midst of all of this great information about resources that can help us to live well. We are so grateful to hear that so many people are, starting to move more. We're getting reports of people increasing their weekly activity minutes, feeling good and enjoying the journey. And also through our feedback forms and also through our office hours, we're really excited to hear that across the nation, across NBC, we're seeing some church health ministries starting to get back to doing more group activities. Everything from church teams participating in charity walks for breast cancer awareness last month, to even some churches that come together and they actually do exercises together at the church after meetings on a weekly basis. So people are finding their fit with what they feel safe doing together. And we're so glad to just see people working out, moving more, whether they're doing it individually or collectively. Some of the feedback that we also have gotten was a call for some additional supports to help people that want to have some instruction on how they can work out safely and enjoyably, not quite knowing what to do or wanting to try something new and needing those additional resources. And because feedback is a driver, we did create and have provided for everyone a resource that is called Exercise Resources. Now, this is in your mailbox. And it does contain, and it's a 6-page document that has information about 3 different exercise modalities: strength training, cardiovascular exercise, as well as flexibility, the benefits and why it's important for us regardless of our age, and to answer that call for resources. We've also listed 3 resources that between them There are over 200 workouts ranging from as short as 10 minutes to up to an hour that you can do at home individually, or if you have in your church the ability to stream things via the internet in some kind of a group space and you feel safe, this is a resource where for free church ministries can encourage individuals to work out at home or safely do so together. So this exercise resource packet is in your mailbox for all of the Let's Move National Baptist participants. Please do take advantage of that, share it with others, and I hope that it is a helpful resource to keep us moving more and moving safely and effectively. I want to also encourage everybody to please continue to put in your activity reports that are going to be every month under that bit.ly. We'll just change out the 3 letters for the month. So this month's report for last month in October that we're reporting in November, you can go to that form at bit.ly LMNB-October 22-activity. Again, information and feedback is a driver, and it helps us to not only acknowledge you, but to celebrate with you. There's some rewards and some incentives that are coming for those that do participate in that. And again, any concerns or challenges that you have, needs, if we can match resources to that, we will definitely do that so that we can support one another in our efforts to be good stewards. And one of those recognitions that we're going to do right now is the monthly drawing. As you all know, on these Temple Care Matters webinars, we have been awarding $100 gift cards to an individual who has submitted their movement. So all you have to do, if you move meaningfully one day a month, that'll give you 1 entry. If you just let us know what you're doing, how you're feeling, what is changing, any challenges, just your participation can pay. So all of those individuals that submitted, they were put into a drawing, and you also have to be on the call. So this is the place where we do not have the sound effect, but this month's drawing winner is Angela McLaughlin. And I did see her on the webinar earlier today. Oh,
Yay!
Congratulations.
Thank you.
Wonderful, wonderful. So do you have anything that you would like to share, Angela? Congratulations on your movement.
Thank you so much, and I appreciate all that you do to help us within Let's Move. And I just want to encourage everybody to, like you say, exercise at least 150 minutes a week. I myself, my goal is 10,000 steps a day, and I'm trying my best to meet that every day. So I encourage you all to join me. Thank you again so much.
Congratulations and bravo on your consistency and good job here and your encouragement. Thank you so much for that. So if you are not part of Let's Move National Baptist, if you don't have that resource in your inbox, if you could benefit from some support and some camaraderie, as even though we're apart, we're together in this purpose of moving our bodies for our health. If you're not part of that, please do join us, and you can do so over at letsmovenbc.com. We get new folks coming on board every month, and we would love to welcome you, work out with you virtually, or as we can pull people together and support you as well. So I think that's it for our report for Let's Move National Baptist. Again, congratulations, Sister Angela, and you all take care. God bless, be well, keep moving. Sister Lottie, back to you.
Yes. Hello. That was wonderful. That was absolutely great. I don't know what, there I am. That was wonderful. Thank you, Sister Natty, and congratulations, Sister McLaughlin. That is super. A little tangible goodie to help you along the way in your fitness efforts. That's super. All righty. So also, November is not only diabetes, American Diabetes Month, it is also Pancreatic Cancer Awareness Month. Pancreatic cancer begins in the cells of the pancreas. And this is something that a lot of us don't know much about. The pancreas is an organ in the abdomen that lies behind the lower part of the stomach. The pancreas has 2 main functions. It makes enzymes that help with digestion, and it makes hormones such as insulin that control our body's store and use of glucose. So, and glucose is the sugar that is our body's main source of energy. There are two forms of pancreatic cancer. Exocrine pancreatic cancer, which accounts for approximately 95% of all cases, and endocrine or pancreatic neuroendocrine tumors, also called islet cell tumors. Smoking, being overweight, having diabetes, chronic pancreatitis, and certain hereditary conditions are risk factors for pancreatic cancer. The National Cancer Institute's Surveillance, Epidemiology, and End Results Program, and that's STEER, Surveillance, Epidemiology, and End Results Program, estimates that there will be an estimated more than 62,000 people diagnosed with pancreatic cancer in the United States, and some 49,830 deaths from those cancers. Well, just this year, that was their estimate for the year 2022. Pancreatic cancer is the third leading cause of cancer death in this country. Moreover, pancreatic cancer is projected to become the second leading cause of cancer-related death in the United States by 2030. That's right behind lung cancer. According to data published in the Cancer Research, in Cancer Research, a journal of the American Association of Cancer Research. So, Sister Nettie, again, thank you for the information you gave us. We've shared about 2 of our health observances. We've given away a little prize. And now we're going to move on to our mental health training efforts. Sister Bettina Campbell, are you going to, Sister Campbell, I don't know if you're going to speak tonight. I know you are traveling, and there you are, and you look like you feel great, and you're here. Praise God.
Good evening. I'm not sure that you can hear me. I did have an incident, and it has an effect on my voice. But on Saturday, October 29th, we had 13 individuals to complete our mental health first aid training and become first aiders and receive a certification. We are currently recruiting in the effort of recruiting 2 individuals to go through mental health first aid training and become exclusive trainers for our National Baptist Convention H.O.P.E program. So we hope to have them on board and ready to go shortly after the first of the year. And for this effort, we do want to give our thanks to the Mid-South Baptist Convention and also to Oak Hill Community Development Center for being so gracious in sponsoring these programs. That's it for tonight. Thank you so much. I just should say that I do have a list running, so if you are interested in receiving mental health first aid training, you can contact me, and I will be more than happy to ensure that you are included on that list for the next training that's coming up. So thank you, and everybody have a good night, and I'm turning it back over to you, Sister Lottie.
Thank you, Sister Bettina. That was fabulous information. Thank you for joining us. You are so dedicated. We know you did have a health challenge, and it seems that it only affected your voice because you were on point with your presentation. So we appreciate you for joining us and doing that for us tonight. All righty, we're going to move on and talk a little bit about another health observance, Alzheimer's disease. It is National Alzheimer's Disease Awareness Month and National Caregiver Month. And this is near and dear to me because I've seen Alzheimer's affect people, and I am currently a caregiver for a relative who has dementia. So this is interesting for me to be sharing tonight as I'm experiencing this new experience that we are going through in my family. So Alzheimer's disease is one of the most common types of dementia. It is a progressive disease beginning with mild memory loss and possibly leading to the loss of ability to carry on a conversation and respond to the environment. Alzheimer's disease involves parts of the brain that control thought, memory, and language. It can seriously affect a person's ability to carry out daily tasks. Although Alzheimer's affects approximately 1 in every 2 families in the United States, there's still quite a bit of information about Alzheimer's that we might not be aware of. Here are a few facts. First of all, Alzheimer's is not a normal part of aging. I'll say that again. Alzheimer's is not a normal part of aging. Second, Alzheimer's worsens over time. Our third little factoid, Alzheimer's has no current cure, but treatment for symptoms are available and research continues. We're thankful for that. Finally, November is the American Cancer Society's Great American Smokeout Month. And November the 17th is our Great American Smokeout Day. And that is a day where we encourage people to put their cigarettes out and to stop. That's a great day to begin the journey. I'm sorry, yes, November 17th. That's a great day to begin the journey to live smoke-free. All right, we have covered quite a bit. But the best part is coming now. We want to hear from you. We want to hear from our audience because you guys are the ones who help make this happen. It is your interest and your prayers and your questions, all of those things that keep us moving and keep us going and keep us striving to give more and more information to the communities that we serve. Some of you have already typed your questions in the chat. If you've not already done so, you're welcome to raise your virtual hand, or you can still type questions in the chat. For those, and this is for those that are on Zoom. For those that are watching on social media, we'll do our best to capture your questions as well. Once again, we want to thank the National Institutes of Health, All of Us Research Program, for being our major sponsor this evening. Let's not forget our October marketing updates, National Church Safety and Security Month, National Breast Cancer Awareness Month, and talk about prescriptions. And those were some of the things that we talked about in the month of October. So let's not forget those things. For additional information and resources about anything that we spoke about tonight, you can go to our website, NBCUSA Hope webpage, which is www.hopenbc.com. That is www.hopenbc.com. I want to again remind you of some upcoming events. November 28th through 30th is our Sunday School Publishing Board Educators Conference at the Gaylord Opryland in Nashville. January 9th through 13th, 2023 is our Midwinter Board for our National Baptist Convention. It will be held in Birmingham, Alabama. You may join on the web and on social media, www.hopenbc.com, our Facebook page, National Baptist Convention USA Inc., Hope Health Initiative, Twitter at Hope_NBCUSA, and of course, YouTube is NBCUSA Hope. If you would like to enroll in our NBCUSA Hope Health Ministry training, you can email us at info@hopenbc.com, or you may call us at 901-603-0762. That's 901-603-0762. And of course, as always, we appreciate your feedback. We ask that everyone who's watching would kindly please submit our survey, complete our webinar survey. Let us know how we're doing. We've pasted the link in the chat, and I'll read the link to you as well. It is https://hopenbc.com/. /webinar-survey. Okay. All right, let's open it up for questions. I don't know if Dr. Minor will be able to join me for this question and answer period or not, but let's go ahead and go through some of these questions to get your input, because we want this to be about you and your questions and helping you to educate the people that you serve in your congregations. All right. Brother Duke, are you able to assist me with questions?
Yes, ma'am. We have a question in the chat. Does marijuana smoke cause lung cancer like cigarette smoke?
Oh, great question. Who would like to take that question?
Hi, this is Virgie Hickman. I don't know if I'm able to speak or not on this.
Yes, ma'am, we hear you.
Okay. Yes, it can, because it's an irritant to the lung. The difference might be the amount of smoke or marijuana that you're smoking. It is a true irritant. And I think now that it's illegal, we're going to see that more as a problem.
So potentially any pollutant like that or irritant could potentially
it's an
cause
irritant.
problems with the lungs.
Yes, it will deposit particles in the lung, which can wind up causing a malignancy. I can't tell you how soon it would take, but anything like that, that's one of the concerns about marijuana smoking.
Very good, very good. Thank you, Sister Hickman. I think Sister Bettina Campbell has her hand raised. Sister Bettina, go ahead.
There may be some concerns. However, to date, there is really no strong data to support that it does. So it's something that researchers are studying, but to date, we have no strong scientific data that marijuana will cause cancer.
Okay. That's a great question. Thank you. Next question, Brother Duke.
All right, I have another question. If a person has private insurance and recently turned 65, should they enroll in Medicare as a secondary insurance?
Great. So that's a great question. So a couple months before you turn 65, you should get a Medicare and new handbook in the mail and some information from Medicare and Social Security about Medicare and your options before you turn 65. And I don't have the exact timeline in front of me, but you do have a certain amount of time after you turn 65 to enroll in Medicare without a penalty. So you should call 1-800-Medicare, and they will answer any of your questions about enrolling in Medicare and about how you keep if you're employed and you have private insurance and you would like to keep that, they will talk you through all of that. We also have some assisters for Medicare specifically called our H.O.P.E. That's our state health insurance program. They're out in every single state, and they help with Medicare enrollment. And so they might be able to help you as well. And if you call 1-800-Medicare, they will be able to help you in person if you're seeking that assistance, or if there's others in your congregation who might need some in-person assistance with Medicare.
Very good. Thank you.
Thank you for that answer. Another question. Does Humana, United Healthcare, etc., check income other than Social Security every year to determine eligibility for renewal of your plan?
So the way, I can't, I represent the Centers for Medicare Medicaid Services, not any private health insurance, but if you have a private health insurance And assuming the question is that you've received that private health insurance through the health insurance marketplace. So it could be that you have a marketplace plan that's provided by Humana, for example, then you can go to healthcare.gov and look up your plan for this year and see what the premiums are and what the cost is, and compare it to other plans as well. So that's one of the things we were talking about earlier, is if you have insurance through the marketplace, you can go in and check your current plan and compare it against other plans for if you still want to continue that same plan or change plans for 2023.
Great.
Wonderful. Great information. I'm looking for other questions in the chat. Brother Duke, do you see any other questions? Or is
No, ma'am, I do not see any more. I think I see something about Let's Move exercise. Someone wants to know where they could find it. I think Sister Nettie can answer that one.
Yes, if anyone is having any challenges, if you're signed up and you're not receiving your emails, we definitely want to check and make sure that email is corrected. So if you can just send the correct email to me at nettiej@hopenbc.com. I'll put that in the chat. We'll check your record and make sure that those emails are getting to you. Now, also, I will do that double check, but also look in your spam folder. We have hundreds and hundreds of people on the email list. And so sometimes your email provider may see that it's coming from an email list and automatically shoot it to spam. So you would need to then just go on ahead and make sure that you check it in there, say it's not spam, so that you can see them in your inbox. Okay. We want to make sure you get your information. Thank you so much for that.
I see one more question in the chat. It's actually from one of our National Baptist members who actually works as a who is an assister, a marketplace assister. So Stephanie, she says that she helped a consumer just as recently as last month with a special enrollment period. So does a consumer who's enrolled that recently still need to go back and see if there are other plans that are less expensive than what they have? I know you've said people that are renewing from last year should do that, but what about from last month?
Yeah, so that's a great question. And I do apologize, my voice, I've been sick all week too. So it's getting scratchy towards the end here. But so if you had a consumer who enrolled in health insurance for October, that is for their plan year 2022. So they have enrolled in coverage, which gives them coverage between October, November, and December of 2022. They should go back into healthcare.gov to look and to enroll in health coverage for 2023. So again, the special enrollment period that they had used this year was to get coverage for the remainder of 2022. The open enrollment period that's now is for 2023 coverage. So they should go back in to check their plans and to make sure that they enroll in coverage for 2023.
Wonderful. So they do need to double check. That's super. Thank you very much. All right, I think that concludes our question and answer period. Thank you all for those great questions and great answers. We are learning, and that's what it's all about. All righty, so we want to again show our thanks and appreciation to the tireless work of our entire NBCUSA HOPE team. Dr. Michael O. Minor, Dr. Desi Levy, yours truly, Lottie Minor, Sister Bettina Campbell, Pastor Dexter Moraney, Sister Ellen McKnight Hill, Dr. Felisa Washington, Minister Geraldine Moore, Sister Loretta Miller, Dr. Labora Williams, Sister Nettie Johnson, Dr. Marion Talley, and Brother Thomas Duke Robertson. Our 7 regional coordinators, Pastor Daniel Blackburn, the Northeast region, Sister Brooklyn Rogers, the Southeast region. I'm sorry, I think Pastor Montgomery's supposed to be introducing his team. Pastor Montgomery, I just overtalked you. Would you like to take that section, sir, or shall I continue? I think he wants me to continue. All righty, our regional coordinators again. Pastor Blackburn, our Northeast region. Sister Brooklyn Rogers, our Southeast region. Pastor Bernard Montgomery, our Southwest Region 1. Sister Linda Copper, Southwest Region 2. Sister Teresa Fales Farr, the Midwest region. Sister Norma P. Jackson, the West region. And Pastor Richmond Johnson, the Far West. And of course, we again acknowledge our president, Dr. Jerry Young, for allowing us this opportunity and allowing us to work with the National Institutes of Health on this great initiative of all of us. Now, we know some of you have additional questions or comments. So in a moment, we will formally close today's workshop, but we'll open up the mics for those that are on Zoom for just general Q&A. We hope to see you all on Tuesday, December the, first Tuesday in December for our next Temple Care Matters webinar. First Tuesday in December. Anyone that has that date that's able to unmute, please share. As I said, we had technology issues, but I thank you all for bearing with us, and we hope that something has been said tonight that will help you in your health ministries, that will help you in your personal health. Again, I do acknowledge once again our president, Dr. Jerry Young, who reminds us to envision the future exceptionally. This has been a production of the National Baptist Convention USA Incorporated, our nation's largest Black denomination. Ladies and gentlemen, thank you for joining us. God bless you. God